நானே எழுதி நானே பாடும் பாட்டு கேளுங்க, இது நல்லா இருந்தால் எல்லாம் ஒரு முறை சிரிச்சு காட்டுங்க, சிரிச்சு காட்டுங்க. சிரிச்சா நோய் போகுது என்று சயின்ஸு சொல்லுதுங்க, கொஞ்சம் சிரிச்சு காட்டுங்க, நோயை விரட்டி அடிங்க, நோயை விரட்டி அடிங்க.
It was started by two youngsters way back in 1993, Vandana and Vaishnavi. And when they were just finishing off their college, it started off when they spotted a homeless mentally ill woman on the street who was literally naked and who was on the streets. And 10 years back, or I should say 16 years back, nobody knew how to respond to a crisis situation like that. For me, it is even more a very personal experience because I was also finishing college at that time, and I by default happened to be a person in the bus stop at that time, you know, watching the entire episode happen. And I myself, I was in the second year and I didn't know what to do myself also. So post that, Vandana and Vaishnavi tried to find a shelter for this woman who was in distress, but they were not able to. Finally, when they managed to find a shelter also, this woman was not able to live in that shelter for more than a week. She kind of went away onto the streets again. So which triggered them to respond to a situation like that, and which initiated this entire movement called the Banyan.
We're sitting currently in our health centre based in the village of Kovalam, a little way south of Chennai city itself. This is Dr. Srinivasan, who's our general doctor. He runs an outpatient clinic 4 times a week, 5 times a week, providing general services to the local community here in Kovalam. One of the benefits of the health centre, having created it from nothing 5 years ago. It's now becoming a service that's relied upon by many people here in the area. We also have a fully stocked pharmacy. The medicines bill is one of the most difficult for us to keep meeting as time goes by. We are very fortunate that many of our supporters are happy to provide for medicines. Within this building itself, there's also a diagnostic lab where we do a lot of the routine tests that the doctors would order. The upstairs part of this building is dedicated to the Banyan Academy for Leadership in Mental Health. One of the big issues in the mental health field is the lack of trained professionals who can impact on the delivery of services. And the aim of the Banyan Academy is to try to generate the learning that is necessary to train those professionals adequately. It contains a number of training rooms and facilities that we use in training those people who are interested in pursuing a career in the mental health field.
நான் சைக்காட்ரிக் சோஷியல் வர்க்கராக இருக்கேன்.
நான் 6வது ரொம்ப கஷ்டப்பட்டு படித்தேன். ஏன்னா எனக்கு ஸ்கூல் படிக்கிறது எனக்கு விருப்பமே இல்லை. ஃபிஷிங் பண்ணுறது தான் ரொம்ப விருப்பம்.
அது மட்டும் இல்லாமல் வெளியிடலாம் நான் பார்த்ததும் கிடையாது, மற்றவங்க நான் பழகினதும் கிடையாது. இப்போ வெளியிடலாம் போகிறதுக்கு ரொம்ப தைரியம் எனக்கு. பேனினுக்கு வராமல் நான் கடலில் இருந்தேன்னா கண்டிப்பாக பணம் நிறைய சம்பாதிச்சிருப்பேன், நிறைய மீனை பார்த்துருப்பேன், கொஞ்சம் மக்களை பார்த்துருப்பேன். ஃபர்ஸ்ட்லாம் தைரியமே இருக்காது, இப்போ வெளியில் போகிறதுக்கு தனியாக கூட தைரியமாக நான் போயிடுறேன். நான் ஒருத்தர் வந்து இப்போ மனசு கஷ்டத்தோடு எங்கிட்ட வந்து பேசுகிறாங்கன்னா அவங்களுக்கு எப்படி பேசி அவங்க மனசு கஷ்டத்தை தீர்த்து அவங்களுக்கு ஏதாவது ஒரு நல்லதை பண்ண முடியுமான்ற ஒரு ஐடியா தெரிஞ்சு வச்சுக்கினேன்.
This is like community fostering that we do every once in a month, or sometimes it so much happens that it's once in 15 days also. and Murthy coordinates the whole show. He, whenever he finds a mentally ill wandering men in the streets, he immediately, brings them to the barber shop, gives him a nice haircut, gives him a good shave, and brings him to the Banyan. We give him a bath over there and also give him good clothes to wear and also food.
I first came to India back in 2001 when the insurance company who I spent 22 years working for offered me the opportunity of contributing to their charity program based in southern India, and I was able to then spend the last 3 or 4 years of my corporate career working directly with 7 NGO partners, 5 in Bangalore and 2 in Chennai, one of which was the Banyan. Part of the way in which we work with the NGO partners was about looking at them as organisations and seeing what corporate experience could do to help to build sustainability within those organisations. And during my discussions with the leadership team at the Banyan, Vandana decided that one way in which she could help to improve the sustainability was to recruit me.
A person is mentally affected, everything for them is new, everything, all learning, everything becomes new for them. So when an occupational therapist starts working with them and we do assessment, and then we get to find out what is their memory level, what is their hobbies, what are their interests. Based on their interest level, we give them activity, we give them training and make them independent. They are doing the variety rice business and also the bhaji and the dosa batter business, of which the variety rice business comes here in the morning, and we have the self-help group members over here. Every day morning they start their work by 6 o'clock and they are here to do the job by 9:30, 10, and they are back to the Banyan by 1 o'clock. Even if they are not turning up for the business one day, like we have the public coming and asking us why they have not come. So it's really a motivation for them.
சாப்பாடு 10 ரூபாய்க்கு இந்த கலியுலகத்துல கிடைக்காது. நல்ல ஒரு சமூக சேவை மாதிரி நல்லா பண்றாங்க. அருமையா இருக்கு சாப்பாடு, எந்த குறையும் கிடையாது.
What's happening in here is a regular group activity. We've hooked up with an organisation called eFarm who provide prepared vegetables for places like Nilgiris and the like. And as you'll see, they're peeling garlic in here in preparation, as well as a number of other activities. Yeah, we do a block printing activity that goes on, mainly done from a therapy point of view rather than from a commercial point of view. At the moment, one of the women that does do some of the block printing is actually employed by a local printer. I, like many people, started life very scared of mental health. I didn't understand it. I just knew that it could affect anybody and at any time.
That's the end of it. He's mentally affected, he can't work, but that's not the end.
One example that sticks out in my mind, a young man came into the health centre. His clothes were all tattered and torn. He was covered in blood from wounds that he had on his hands and his feet.
So one experience that I had here was one of the most chronically ill women whom we thought we can't do much about it and all.
3 weeks later, when I was next back in the health centre, you would not have recognised this young man.
So today when she comes and she sees me, she's got that smile and she thanks me so much, and I feel really happy that I've got meaning to her life.
Timely intervention with both medicines and also with rehabilitation, therapy, counselling, activity planning. He was able to reconnect with his wife. He's now working.
நானே எழுதி நானே பாடும் பாட்டு கேளுங்க, இது நல்லா இருந்தால் எல்லாம் ஒரு முறை சிரிச்சு காட்டுங்க, சிரிச்சு காட்டுங்க. சிரிச்சா நோய் போகுது என்று சயின்ஸ் சொல்லுதுங்க.
ஆர்ட் வரைகிறது வந்து எனக்கு ஒரு சாட்டிஸ்ஃபேக்ஷன் கொடுக்குதுங்க. அது வந்து அதாவது ஒரு காம்னஸ் கிடைக்கிது. ஃப்யூச்சர் ஆம்பிஷன் வந்து ஒரு ஆர்டிஸ்ட், நல்ல ஆர்டிஸ்டாக வரும்.
கொஞ்சம் சிரித்து காட்டுங்க, நோயை விரட்டி அடிங்க, நோயை விரட்டி அடிங்க. ஏன்னா நான் படிக்கலை, எனக்கு எழுதவும் தெரியாது. அது ஒருத்தர்கிட்ட கொடுத்து எழுதுவேன், புட்டி கணக்கில் வச்சுருக்கேன். இப்போ இந்த மாதிரி ஒரு பத்திரிக்கை நிருபர் யாருன்னா வந்து பார்த்து ஒருவேளை இந்த சாங் நல்லா இருக்குது அப்படின்னு சொன்னால் அப்போது வெளியே வரலாம், இல்லைன்னா அது அப்படியே அழிஞ்சு போகலாம்.
It had a very human angle to it. Nobody was being looked at as a patient or as a case or as a file number, or everybody had a name. Each person had an identity. You know, when you see a homeless mentally ill person on the street, you see that the road is very crowded. There are thousands of people walking up and down. There's a lot of vehicles going up and down, but still this person is in the background, is always in the background, not even willing to, not even begging for alms or anything, but just happily living an existence behind. But it is a very traumatic thing for the person without the person's knowledge itself. Each person rescued has been a unique person with a name, with an identity, with a unique story to tell.
This is the Banyan's community living project. It was started, or rather inaugurated, in 2007. One of the problems with having a transit care facility is that not everybody can go home, and that some will end up staying for a long period of time. So what we wanted to try to do was to find a community kind of setting where those longer stay residents could be a community in themselves. What you have is a central meeting place surrounded by 10 individual cottages. The aim is that we create communities where people own their own cottages, where they work within their own cottages. Interestingly, the community living project started as simply a place for people to go and seemed to be like it was the end of the story. But the reality is that around 22 of the women that we have had come here have ended up transferring and living independently.
நான் வந்து இப்போ பிளாக் பிரிண்டிங் பண்ணிட்டு இருக்கேன்.
मीत बामें सुनारा है काम वाला है मीत काफी काम करते हैं
அயன் பண்ணிட்டு இருக்கேன்.
मैं मोंटेसरी स्कूल जा मारता ट्यूशन गया मारता
இங்க லைப்ரரியில நான் வர்க் பண்ணிட்டு இருக்கேன்.
This is the highly charged group. This is the self-help group of the Banyan. They started their journey from the streets of Chennai. I'm saying this with good liberty because we've all grown together. We don't hide the reality from our eyes. We know we've come from here, and these are all the success stories of the Banyan.